So we're going to go over the mandible. We're going to have a 40-inch SID. We're going to use an 8x10. I'm going to start with the PA position, which is going to be, the central ray is going to be perpendicular. There's no angle. All right. So for this one, I want to have my patient put their forehead and nose on the board. So tip your chin down just a little bit. And then I want to make sure that my OML is perpendicular to the IR. So tip your chin down just a little bit more. Good. Now for the mandible, I'm going to have my central ray exiting at the level of the lips. This board's going to lower down in front of you. It looks a little bit low down here. If you can see, the bottom of our light is coming down into the back. That's fine, because when we tip the chin down, that brings the mandible down a little bit, so we can still visualize that. We should have light above the EAM or to about the top of the ear. And then I just need to double check and make sure that there's no rotation and that I'm centered to that mid-sagittal plane. So that's just the straight PA with the central ray perpendicular. Then what I'm going to do is the axial laterals. So I'm going to have my patient rotate in a true lateral position, so face me. So different than the other laterals that we do where we put the patient in a 45-degree oblique so we can get the patient close without OID. What we want to do is keep them in a true lateral so their shoulders touching the board. And the method that we do to get a general survey view of the mandible is to angle our patient. Some of them you want to put a 25-degree cephalad angle on the tube, but what we're going to do is just angle the patient. So keep that space to have OID, and then what you do is tell your patient, tilt your head in until it's touching the, kind of laying on the board, and then bring your chin up for me. So what we're doing with that is we're tipping the mandible up so we can get the upside out of the way so we can visualize the downside of the mandible. So I'm going to have you stay just like that. I'm going to center just below the upside of the mandible, so my central ray is entering on that downside. I'll bring you forward a hair. I'm going to change my collimation to crosswise just to get all of the anatomy on there. I'm going to put my right marker here. We need to ensure that we have light above the EAM and behind the EAM to make sure that we're not clipping any of the mandible. And we should be able to see the shadow of the mandible here. So for the axial lateral, we always do both right and left sides. So you do the right and then spin them around and do the left. I'm not going to do that for right now. All right. All of the breathing instructions for these are just hold your breath. So don't breathe, don't move. So then I would have him turn and put his back up against here to do the AP. So the AP towns for the mandible. We're going to go to either a 30 or 35-degree angle. Technically, the book will say 35 to 42. You do not need to go to a 42. And then what we're going to do is have our patient tilt their chin down again until their OML is perpendicular to the IR. Tuck your chin. Oops, I'm sorry, a little bit more. Okay. And then for the mandible, we're going to put our central ray at the glabella. This board's going to lower down behind you a little bit more. Make sure that I'm mid-sagittal plane and there's no rotation. And I'm going to check one more time. Tuck your chin down just a little bit more. Making sure that OML is perpendicular. Again, you're centering at the glabella, but you always want to double check. Since I had him tuck his chin down a little bit more, I had to adjust it. But always check to see if you can see the shadow of the mandible with the light below it so you're not clipping it. Okay? After the AP towns, you can relax. I'm going to do the SMV. So I'm going to take my angle off. I'm going to have my patient scoot out about 12 inches away from the board so that they have space. I'm going to have them tip the head of your head back until the top of your head's touching that board. I want to make sure now that the IOML is parallel to the IR. I need to make sure that there's no rotation in my patient. Can you bring your chin up a little bit more? And then I'm going to center midway between the angles of the mandible. This board's going to raise up behind you. I'm And I'm gonna just make sure that my marker's in there. Then I would have my patient again, hold nice and still, don't move. I'm gonna take that exposure and help them up when they're done, and you can relax. So that's it for mandible, but you're gonna perform both axial laterals, the right and the left.